Hi, everyone, and welcome once again. To give you a bit of an update of what's going on provincially, let's begin with the provincial numbers, which are actually looking good. We had 270 cases added from the previous day as of this morning, and that is probably the lowest we've had, I would say, in a year, and that is very good provincially. We're seeing lower numbers across the province. In Ottawa, they had 12. And so in our region, we're seeing that trend as well. If we look at our map where we are now, we have a total of 11 cases. We have one hospitalized individual in an ICU in Toronto, in the Ottawa hospital. Seems to be very stable, however, so that's good news there. We have no outbreaks at this point in time, and over the weekend we added one case, which is very good, to the point where at this point when I'm looking at the statistics of our website, of our data, our positivity rate is 0.6%, and we do not have an R effective calculatable, because you need at least 12 cases in a week to be able to calculate it. So we don't have one. The other thing too is that in terms of variants of concern, most of our cases, actually all of our low numbers that we've had, were variants of concern, but none of them were the Delta. So at this point, we don't have any Delta activity in our area that we know of. I can tell you that we had one case of Delta, I would say about a couple of weeks ago, but that was it stopped there. There was no other collateral cases from that one. So at this point, we're doing very well in our area, and again, we need to continue with a very low rolling average, which is really in the low range, which brings us in the green zone, and a range that we need to keep as much as we can. Again, very good news for our area as we go into our second week of step one, and then going into step three the first week of July. So looking good for us. Again, let's keep going with the measures to ensure that this number stays low, as it has been now for at least a good 10-12 days from now. So that's it in terms of our numbers. You can see here that we've actually administered almost 160,000 vaccines in our area. We're continuing to do so. This does not include the numbers of today, a couple of thousand today. So I really want to spend some time talking about our vaccines moving forward, some changes and so on. So the first thing that I just wanted to say is that the eligibility for vaccines has changed right now for second dose, and so effective today, individuals of any age who received their second dose May 9th or earlier are now able to book a second dose appointment. And I do recognize that we've had people that have gone on, and as of this morning, there were some spots available. They were all taken in Cornwall and in Rockland, but we do have some availability in Hawkesbury. To date, between now and July 9th, we have 24,000 booked in our clinics, and we will be adding beyond that next week. Now, the reason we're waiting is there's going to be a decrease in delivery of Pfizer in the month in July sometime. It's going to be made up. It's not that we're getting less overall, but again, we're just hesitant to put the clinics in, but we will be putting the clinics in. So so please, if you go online and there's no appointment, we will be adding those very shortly. And so just keep going back. The other thing as well is that positions will be opening up, because we have people that are on standby in our clinics, and if they're on standby, they will cancel their second dose. They won't need a second dose. It'll open up a position. Similarly, people who have received it from pharmacies, because pharmacies are getting more and more across our area, there's 43 of them, they will be able to get a second dose over there as well. And so if you have got a second dose in one of those two areas, but still have an appointment that you don't need, please go online and cancel it. That's very important that you do so as we move forward in that regard. The other thing that I wanted to say is that as of next week, June 28th, everybody will be able to go online and get an appointment for earlier than a 4-month interval. And it could be as close to 28 days and so on for individuals over 18 years of age. For 12 to 17-year-olds, we're still at the 8-week interval between the two vaccines. Speaking of which, we still have availability for 12 to 17-year-olds. I urge parents and to get their appointment if they haven't already done so. And that brings me to Pfizer and Moderna. We will be actually receiving our Pfizer delivery late this week. However, we have a lot of Moderna on board. And so I just wanted to speak to we just sent out a press release to that regard. Moving forward, most of our clinics will be Moderna clinics, but and that doesn't there is interchangeability, so I just want to stress now that we have evidence that if you had a first dose Pfizer and get a second dose Moderna, or vice versa, that's fine. Individuals that received AstraZeneca, when it's time for them to get a second dose, they can get either Moderna or Pfizer. In our situation, over the next week or so, at least, we will be having more Moderna available. We will be reserving the Pfizer for 12 to 17 because it's the only vaccine that is allowed in Canada for them, approved in Canada for 12 to 17-year-olds. So that's why I want to dispel any myths about Moderna or Pfizer being better than each other. Both of them are equally effective. They are mRNA viruses. They work the same way. It's just two different companies making similar products. It's not unusual for us to interchange vaccines. We do a flu vaccine all the time. Sometimes we use different vaccines from different manufacturers for our childhood immunizations, our measles immunizations, and so on. So that's nothing new to us. We know that there's data that supports the interchangeability of these vaccines moving forward, just like we've done with other vaccines that we've been routinely using. So it's very important that, again, we need to stress that interchangeability is fine. The response rate will be the same for one mRNA to another vaccine, and that will protect you. The other thing I wanted to say as well is for the Delta variant, there's a few updates that I wanted to share with you. Number one, we have seen that after first dose of the vaccine. By the way, we are at today we should be over 80% of first dose to adults in our area, in our region, and starting to pile up the second doses, obviously, which we want to pump out and accelerate over the next 4 to 6 weeks, obviously. I just lost my train of thought, actually. So in terms of the vaccines, I wanted to just talk a bit about the, I talked about interchangeability, and I talked about the second dose. I forgot what I was going to say, but it'll come to me in a second. But again, it's just a matter of us getting out there. And like I said, we're at a high percentage in our area, and we wanted to. I just wanted to make sure I don't forget. I put a note to talk about one issue about eligibility, about that.
The Delta variant.
And oh, yes, thank you very much, Benjamin. It was a variant. Thanks. I lost track here because I talked about that. So variants, very important. So the variant, the Delta variant, although we don't have it in our area, we know that is the issue where we do have the biggest threat. And there are a couple of differences with this variant as compared to the other variants, the Alpha variant, which is the UK variant, which is mostly the one that we have in our area, actually, here. So the Delta variant is 1.5% more transmissible, easily transmissible than the Alpha variants, and certainly more than the original virus. Secondarily, we know that one first dose of the vaccine will protect you about 35% or so from getting the infection. However, we know that one first dose will prevent you 85%, if not more, whether it's an either RNA vaccine, even with AstraZeneca second dose, you will get an over 85-90% protection against hospitalization. So that's very important. However, we still want to be careful with the Delta virus, itself, the Delta VOC. And of course, that's why we want to accelerate the second doses. But I just want to make people understand, and what we're seeing in certain areas, my colleagues have shared with me that I think in Waterloo, for example, there was a cluster of cases in a certain congregate setting, and there were hospitalizations as a result. 80% of those hospitalized have not even received one dose of vaccine, and the remainder, about the other 20% who were hospitalized, had received a first dose of vaccine, but literally a couple of days before they got sick. As you know, you need at least 2 weeks for the vaccine to be protective. So I'm cautiously optimistic that, we got to be careful. If we have a case, we got to make sure we isolate it. We need to take those precautions because it can spread quite easily. But again, first dose does offer some protection, but it doesn't prevent it from spreading, to the extent that we want it to be prevented. So that's one of the reasons we want to ensure that we get second dose in people so we can prevent infections from spreading easily. And again, when we get a case, we are very, very meticulous in making sure that we identify contacts and we ensure that the isolation is in place. So I just wanted to say that. Thank you for the reminder, everyone. Bonjour tout le monde. Je vais parler des cas en Ontario qui vont bien actuellement. On a augmenté de 270 cas depuis le jour précédent. Je pense que c'est le chiffre le plus bas que j'ai vu au moins dans les derniers 10 mois. Donc, ça va bien à cette échelle-là. Au niveau de la récente Ontario aussi, on voit la même tendance. Ottawa avait 12. Dans notre région, on voit encore de bonnes nouvelles chez nous. En effet, nous avons 11 cas actifs dans notre région, un hospitalisé, pas dans notre région, c'est une personne à l'hôpital à Ottawa qui semble voir mieux. Il est à soins intensifs, cette personne, mais ça semble que ça va mieux. Au niveau des flambées, on n'a aucune flambée actuellement dans des maisons de retraite ou des maisons de longue durée. Et on peut voir ici, au niveau de la variation, que nous avons ajouté un cas depuis vendredi. Donc, ça va bien avec cette tendance-là. Puis, au niveau des moyennes mobiles, vous voyez qu'on est vraiment en bas. Ici, dans notre région, à peine en bas de 5. Donc, le vieil système on est vert, la couleur, on est vert, mais vous voyez nettement qu'on est très bas et ça va bien depuis au moins 10 jours ici. Donc, ça, c'est des bonnes nouvelles pour nous, à un moment donné, qu'on peut faire qu'on continue avec les mesures de santé publique, mais là, on est à la deuxième semaine de l'étape 1 et vous savez que la première semaine de juillet, on va aller dans l'étape 2 si tout va bien. J'espère que ça va aller bien, non seulement avec nos cas, avec le taux d'immunisation que déjà nous avons, je pense, réussi parce que d'aller à l'étape 2, on devrait être à 70% de la population vaccinée. Nous, on est nettement plus que 80% de notre population et d'avoir 20% de la population avec deuxième dose, on l'approche chez nous aussi, ce chiffre-là. Donc, il faut continuer avec toutes les mesures de santé publique. Vous voyez ici que là, on est rendu à presque 160 000 de vaccins donnés qui représentent, comme je dis, plus que 80% de la population avec une première dose et on commence à augmenter le débit avec lequel on donne la deuxième dose à la population. Donc, je vais parler un peu des vaccins. Il faut dire que l'éligibilité a changé. Dès aujourd'hui, les personnes qui ont reçu la première dose avant le 9 mai pourront aller sur le site web et prendre un rendez-vous rapproché ou avancé pour la deuxième dose. Il faut dire aussi que ce matin, nous avons 700 places de libre qui sont déjà bookées à Cornwall et à Rockland. Nous avons encore la place à Hawkesbury. Et s'il vous plaît, ne découragez-vous pas. Parce que jour à jour, on a des ouvertures parce qu'il y a des personnes qui reçoivent la deuxième dose aux pharmacies ou dans nos cliniques stand-by. Et donc, en ce moment-là, si vous êtes dans cette population, s'il vous plaît, allez sur le site web. Si vous avez un rendez-vous que vous n'aurez plus besoin, allez l'annuler. À ce moment-là, ça va ouvrir des places. Il faut dire aussi que nous allons ajouter des des cliniques de vaccination la semaine du 9 juillet. Aussi, nous avons 24 000 places déjà bookées d'ici le 9 juillet. Donc, on va très bientôt avoir d'autres vaccins, d'autres cliniques, donc découragez-vous pas. On aura en masse pour vous donner votre deuxième dose, que j'espère qu'on pourrait faire pour tout le monde qui veut l'avoir d'ici le fin août ou avant, ou même avant. Donc, ça, c'est des bonnes nouvelles. Faut dire, je ne veux pas oublier aussi que dès la semaine prochaine, les personnes qui ont reçu leur vaccin après le 9 mai pourront aller sur le site web pour eux aussi rapprocher leur deuxième dose, avancer la deuxième dose et nous aurons les cliniques fur et à mesure à ajouter. Nous avons des centaines de cliniques d'ici le deuxième semaine de mois d'août. Donc, on aurait la place et le vaccin pour tout le monde. En parlant de vaccin, je veux dire aussi que cette semaine, nous allons avoir un délai de la livraison de Pfizer qui vient des États. Donc, cette semaine, dans toutes les cliniques, nous allons offrir juste le Moderna aux adultes, sauf les jeunes 12 à 17 ans. On va réserver le Pfizer pour eux parce que le Pfizer est le seul vaccin qui est approuvé de par Santé Canada pour les personnes 12 à 17 ans. Donc, ça, c'est très important. Et je veux juste souligner, on vient d'avoir une media release que le Moderna et le Pfizer, on peut les changer, soit qu'on reçoit première dose Pfizer, deuxième dose Moderna ou vice-versa. C'est la même chose. On a le même type de réaction, c'est le même vaccin. Nos corps réagissent de la même façon au niveau de la protection. Ceci est un phénomène qui n'est pas nouveau pour nous. En effet, on change souvent les différents types de vaccins qu'on fait, antigrippal ou même les vaccins qu'on donne aux jeunes enfants, rougeole, etc. On peut changer des fois les manufacturiers, les personnes qui le fabriquent, mais c'est le même type de vaccin. Donc, ça, inquiétez-vous pas, soit Moderna, soit Pfizer, si vous avez reçu comme première dose un autre et vous recevrez une autre deuxième dose, il n'y a pas de problème. Ça ne va pas changer aucunement la réaction de votre corps et la capacité de prévenir le COVID une fois que vous êtes vacciné avec votre deuxième dose. La même chose arrive avec les personnes qui ont reçu AstraZeneca, soit qui peuvent recevoir soit Moderna ou Pfizer, mais cette semaine, mais surtout cette semaine, parce que nos Pfizer, on va les recevoir soit mercredi ou jeudi. D'habitude, on les reçoit lundi. Donc, cette semaine, on va réserver le Pfizer pour les jeunes 12 à 17 ans. Comme je dis, il n'y a aucun problème de façon scientifique. Comme je dis, c'est un phénomène qu'on fait souvent avec les vaccins depuis des années. Donc, ça va aussi, parce qu'on va recevoir pas mal du Moderna, on va avoir beaucoup de Moderna, donc on ne veut pas retarder la deuxième dose parce qu'on n'a pas assez de Pfizer. Donc, c'est pour ça qu'on le fait. Ce n'est pas juste nous, c'est à travers d'Ontario qu'on le fait. L'autre chose que j'aimerais parler aussi, c'est qu'au niveau de l'éligibilité des personnes qui étaient vaccinées après le 9 mai, eux autres, la semaine prochaine, pourront aller sur nos sites web, sur le site web du ministère, pour vraiment prendre, pour rapprocher, pour le 20, soit la semaine prochaine, qui est comme, donc l'éligibilité, la capacité d'avoir un deuxième rendez-vous rapproché pour tout le monde va être le 28 juin. Pour des personnes vaccinées avant le 9 mai, dès aujourd'hui. Ils pourront aller pour avoir un rendez-vous. Bien sûr, les rendez-vous peut-être vont être difficiles, mais découragez-vous pas. On va avoir des vaccins sur ça. Je vais parler aussi un peu des variantes et les vaccins. Des variantes Delta, comme vous savez, ceci se transmet de façon plus facile que les autres variantes. Et nous savons qu'avec un vaccin, une dose de vaccin, on peut prévenir 34-35% des infections, mais avec un vaccin, on pourrait prévenir à peu près 85% ou plus des hospitalisations, d'être admis à l'hôpital. Donc, la première dose malgré que ça ne nous protège pas contre l'infection comme telle, mais ça nous protège de façon importante contre l'hospitalisation. Un exemple, c'est à Waterloo, il y avait une flambée avec beaucoup de cas. Il y avait des personnes qui étaient admises à l'hôpital avec le variant Delta. Et qu'est-ce qu'on a trouvé? C'est que 80 ou plus que 80% de ces personnes qui étaient hospitalisées n'étaient aucunement vaccinés. Et 20% étaient vaccinés, mais à peine quelques jours avant qu'ils aient tombé malades. Comme vous savez, ça prend 2 semaines pour qu'on ait une protection optimale après une dose de vaccin. Donc, ça, c'est très important de savoir que c'est une menace parce que ça peut se transmettre beaucoup plus facilement, mais de notre côté, c'est pour ça qu'on pousse d'avoir le deuxième dose. Le deuxième dose va protéger aussi contre les infections en général, comme on protège les autres, mais en général avec le Delta, le variant Delta, qui semble être plus facile à se faire transmettre d'une personne à l'autre. Donc, c'est pour ça que nous avons hâte de vacciner, de donner la deuxième dose, qu'on puisse diminuer la menace présentée par le Delta, qu'on n'a pas dans notre région. Je peux dire aussi que dans notre région, nous avons presque tous nos cas sont les variantes, mais sont de alpha, celle-là de Angleterre, qui répondent très bien au vaccin, même à première dose. Donc, et nous n'avons aucun cas de Delta dans notre région. Je pense qu'il y avait quelques-unes à Ottawa aujourd'hui, mais pas dans notre région. Je peux vous dire qu'il y a quelques semaines qu'on avait un cas positif avec le souche Delta, mais on l'a isolé, n'a aucun cas secondaire suite à ça. Et ça, c'est le but que nous avons. Nous voudrons vraiment isoler les cas, identifier les cas, isoler comme il faut. Entre-temps, on va vacciner tout le monde. Donc, je pense qu'on est sur la bonne route au niveau des vaccins. Je pense que c'est encourageant. Je suis optimistique, malgré qu'on doit être prudent, qu'on pourrait vraiment vacciner tout le monde d'ici fin août, deuxième dose. So I was going to answer, I've actually answered most of the questions that I've had today in terms of the waiting, the clinics. One question that is interesting here, are there any timelines or benchmarks for when the orders, my Section 22 orders, will be lifted? That's a good question. We're now looking at, for now, the recommendation is masking and physical distancing remains the same. As we get into the high levels of second dose, so I'm talking 75, 80%, this is where we will start seeing changes at the provincial level of masking mandates, masking conditions, and so on. And we will then review each and every one of our directives and our Section 22s based on those to align with those, obviously. So that's to come. But at this point in time, we're reviewing all our Section 22s, and we're going to be aligning them with any regulation that comes up moving forward. But I can tell you that, again, for masking and everything else, that will follow suit. We will be having new guidelines, and they will be progressively stepped, like what can you do in step 2, what can you do in step 3, what can you do if a majority are vaccinated, and so on, different circumstances. You know, what's going to happen is eventually we're going to end up with having likely, you know, no masking if you're all vaccinated, except, for example, if you are immunocompromised, or if you, for example, are taking care of somebody who's immunocompromised, or if you are very, very crowded public places and so on. So, and those things again will be less mandated as we go on, both looking at percentage of population and the epidemiology that we have locally. So, but at this point, we still need to continue with the current masking and public health measures that we have in place. And that's it, Nick. We're going to open up to questions.
Thank you, Dr. Paul. We have 4 media outlets that have questions for you in the queue. Philip Blanchard from the Morrisburg Leader, the floor is yours.
Good afternoon, Dr. Paul.
Hi, Philip.
So my first question, vaccine clinics in some larger areas of the province have been having issues with people not showing up for whatever reason for their appointments. They've already gotten their second shot and haven't canceled or whichever. Yeah. And that means that the standby lists are being used as infill. Has this been a big issue in the EOHU, and has there been any shots that are being wasted?
No, so far, no. And we have a very good standby system now that works very well. And so far, we have not had to waste any shots.
Okay. Second question, any updates on recreation and sports restrictions and regulations since we talked last week?
No, as you know, there's going to be team sports allowed outdoors, and we're expecting, when I asked the ministry last week, when are we getting the regulations? They said 7 to 10 days. So that was last week. So hopefully we'll get something this week, Philip.
Okay, and last question. Right now, there are no approved vaccines for children under 12, and schools are expected to reopen in September and have less restrictions in place.
Yeah.
But the timeline for approval for under 12 vaccinations would be sometime late fall. So do you have any concerns about under 12 students returning to school when there's like variants, like the Delta variant in that, with having restrictions, but still they're the one at most at risk at this point?
Well, this is why we want to be able to vaccinate a very high percentage of our population. If we're looking at 80-85% of individuals more than 12, you've got a good herd immunity. If you've got good measures in place in the school, all the other measures that we have, all those multiple layers of protection in the school, and you have everybody around them vaccinated, including at home, including teachers, school personnel, bus drivers, you're actually minimizing their exposure to it. And then if you layer on other measures that we're going to be looking at right now, trying to figure out what the optimal measures are, I think you're protecting them indirectly. It's not uncommon, Philip, for us to have vaccines that are not yet available for younger people. Yet we see, but we're over, like, for example, I'll give an example. There was a vaccine for something called Haemophilus influenza B. Haemophilus influenza B is a bacteria that used to maim and give meningitis to kids less than 2 years of age. That's what I used to see as a pediatrician back in the 80s. And what happened was when the vaccine came out, it was only available for kids older than 5. And which were the ones that weren't really suffering from that. It was the younger kids. But when that vaccine came out and we started vaccinating everybody, the incidence rate dropped dramatically in the kids yet less than that, because nobody around them had it. So I believe that in the interim, until we get the 5 to 11, which likely will be by the end of the summer, and maybe even after school starts, the indirect protection. That's why we're trying to push second dose and optimal. Even if we get 80-85% of the population, that's going to really decrease it. So the viruses, even they're a variant or not, they depend on bodies that are susceptible. The less susceptible around, the less it's going to be in the community. And if you add the other measures that we're talking about, I think it'll be safe for the kids until we get such time where we can vaccinate 5 and above.
Okay, thank you very much.
No problem.
Thank you, Philip. Nicole Williams from CBC Ottawa, the floor is yours.
Hi, Dr. Paul.
Hi.
I know you said that there were no vaccines going to waste, which is good, obviously, but I'm wondering if there have been any instances in which people who have been offered a Moderna vaccine have walked away from it because it's not Pfizer. Has that happened? We're hearing that in other health units.
Not yet with us. We anticipate it this week, and that's why we're doing a public messaging, and we're telling people that the interchangeability is fine. We have made sure that our staff know, that our vaccinators know. So far, we haven't had that because we didn't yet have this approach. Last week, we had enough Pfizer, but this week we'll tell the tale.
Is there any sort of plan in place if you do have a number of cancellations on Moderna vaccines? What happens if that becomes a trend?
If that becomes a trend, we're going to have to relook at how significant the problem is. Do we have other alternatives for them? Do we wait until they get the Pfizer? Those are the things that we're going to be looking at. At this point, I don't have a degree of magnitude of that issue, so it'll all depend with the degree of magnitude that occurs with us.
Thank you.
You're welcome.
Thanks, Nicole. Denis Babin de Radio-Canada, la parole est à vous.
Oui, Dr. Paul, ma collègue Nicole de CBC vient justement de poser la question à savoir si justement il y avait des gens qui étaient réticents à vouloir obtenir, bon, par exemple, des gens qui avaient été vaccinés avec le vaccin Pfizer et qui, là, se font offrir le Moderna. Est-ce que vous avez été témoin, justement, d'une certaine réticence de la part de ces gens-là?
Non, pas pour le moment. En effet, nous utilisons Moderna beaucoup maintenant dans nos cliniques, mais cette semaine va être vraiment la première fois qu'on offre le Moderna seulement, pas le Pfizer aux adultes. Donc, c'est une chose à suivre, mais pour le moment, on n'a pas, ce type de réaction parce qu'on n'était pas dans la position, on avait les deux dans nos cliniques. C'est cette semaine dorénavant qu'on va voir parce qu'on a une pénurie vraiment pas une pénurie, c'est que la livraison de Pfizer va être plus en retard et nous aurons au moins 5-6 cliniques qui vont avoir juste le Moderna. Donc, c'est une chose à suivre.
Et comme vous le disiez, les doses de Pfizer vont être réservées pour les jeunes de 12 à 17 ans.
Oui. Si à un moment donné, on aurait encore beaucoup de Pfizer qui reviennent, puis on a un choix, on pourrait l'offrir. Mais pour le moment, je pense que si, moi aussi, personnellement, j'ai été vacciné avec Pfizer pour première dose. Si c'était pour me vacciner avec Moderna deuxième dose, je n'aurais pas de problème. Mais je veux juste souligner que ce n'est pas la première fois qu'on fait les changements, qu'on peut changer un vaccin de l'autre. C'est les mêmes types de vaccins, ce sont des mRNA vaccines. Donc, à ce moment-là, je ne pense pas qu'il y aurait un problème, mais je comprends qu'il y a une résistance. Je peux vous dire aussi qu'on a eu des cliniques, surtout quelques cliniques qui étaient exclusivement Moderna et on n'a eu aucun problème.
Encore merci, Dr. Paul.
Pas de problème, Denis.
Merci, Denis. Eric O'Brien from City News, the floor is yours.
Thank you. Hey, Dr. Paul.
Hi, Eric.
My question is about Cornwall. So you mentioned that Cornwall had no vaccine appointments available. We've got a lot of calls over the last week for people traveling to Cornwall to get their second dose, Alexandria, all the way out to Kingston. I mean, what are your thoughts on people from other health units coming in and getting a faster second dose?
My thoughts is that our people from our area go to Ottawa and Kemptville as well. And I was actually with the ministry on the call today talking about it. And if you look at the numbers, they're a wash. We have just as many coming in that are going out. And this is an Ontario effort. It's not an Eastern Ontario or Ottawa effort. So we have vaccines. We're not taking away vaccines from people in our area and vice versa.
Good to hear. All right. That's my only question.
Okay.
That's it for the questions from the chat box. Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. That appears to be all the questions for today, Dr. Paul.
Thank you. Merci tout le monde. Bye-bye.
Bye-bye.